Hello, everybody, and a really warm welcome to this session. Thank you so much for joining us today. My name's Andy. I've worked at Pullman Dentex for the last 7 years, and today we're going to be talking about mouth cancer action live. It's a focused session speaking to two of our dentists that work in the business, and we're joined by a very special guest as well, who we'll introduce very shortly. So in terms of in the clinical seat today, the hot chair, we've got Dr Matt Parsons, who's one of our dentists, and Dr Catherine Tannhill, who is also one of our dentists in the business. And we're going to be joined by Karen from Karen Coates from the Oral Health Foundation as well, who comes with a wealth of knowledge. Karen is an experienced dental nurse and also an oral health educator, because of course we all need education, and a good talking to when it comes to our teeth and looking after our oral hygiene. So really important, this session aimed particularly at 18 to 70-year-olds who aren't aware potentially of the importance of a dental checkup, and that includes having the mouth checked for oral cancer, of course. So let me bring on our two clinicians first of all, Matt and Catherine. Welcome to you both. How are you both doing today?
Good, thank you.
Hi, Andy.
Great, Matt. Hi, Catherine. How are you?
Yeah, good, thank you.
Great
Nice
stuff.
to see you.
Great stuff. It's good to see you too. Well, I've got some questions for you, chatty interview style, if that's okay for you today. Catherine, I'm going to come to you first of all. If anybody's listening today that was a bit like I was when I was younger, potentially afraid of going to the dentist I was, how exactly can a dentist help with mouth cancer, Catherine?
Dentists can help in all sorts of ways. I think it's really important to realise that one of the fundamental parts of your dental health examination when you go for a checkup is actually the screening that the dentist or the hygienist does for mouth cancer. So that's part of your normal appointment. We'll be looking and checking. I think some dentists are really good at telling you that's what you're doing, or that's what they're doing in that appointment. And some dentists will just be doing it and maybe not telling you about it. So that's the first thing, really. It's that important screening. We're looking for any little signs or anything that doesn't look quite right as part of that checkup. And then the other thing where dentists can help is also advice on preventing mouth cancer. A lot of people are unaware of the causes of mouth cancer and how we can protect ourselves against those things. So yeah, it's really the screening to check for any signs or symptoms, and also advice on how to protect ourselves against mouth cancer.
Yes, thanks, Catherine. Matt, let me come to you to build on that. How exactly does a dentist check for mouth cancer?
Like Catherine said, really, it's probably happening without patients necessarily always realising. We have a look at the bits that you can see very obviously. So even, when you walk into the room and we're saying hello, when we're lying you back in the chair, we're already starting to have a look at, your skin and your kind of your structures outside your mouth while we're greeting you. And then we'll move on to, everyone does it in a slightly different order, then we'll move on to the bits that you can feel. So, a lot of people will remember from the last checkup that the dentist felt around kind of underneath the jaw and down the neck, and we're checking for any lumps or bumps there. And then finally, we'll look at the bits that are maybe not so obvious to see. So underneath your tongue, down the side of your tongue, under your lips, and all those kind of places where, some things can be lurking from time to time. And we're just kind of looking and feeling at all the spots that these nasty things can pop up, really.
And what would some of those nasty things look like? I suppose, what are the signs and symptoms connected with mouth cancer?
There's loads, and I'm a little bit cautious here because I don't want everyone to go and diagnose themselves with mouth cancer at the first sign straight away. So there are things that we look for, but they all come with a couple of caveats. So a big one would be, for example, a mouth ulcer that has been present for 3 weeks or more. So we all get ulcers from time to time. We don't everyone thinking that we've got cancer. see an ulcer in the mouth. But if it's been there for a little while and there's no obvious cause, so for example, it might be that you've had a sharp tooth causing the ulcer or that kind of thing. So that's one thing. Also, different lumps, different bumps, different white and red patches. But again, they all come with a caveat that, not every white or red patch is something to worry about as well. So this is why it's so important that you're being seen by someone that can filter out the normal things that happen in a mouth from time to time, and hopefully spot the ones and the red flags that might be worrying.
So I shouldn't go rushing to a mirror then and get worried if I see something that I like that in my mouth, or necessarily. But is it something that I can do at home, Catherine? Can I check safely at home my own mouth?
Yes, I think, as Matt said, there are things in your mouth which look strange once you start to look that are completely normal. So I'd encourage people to get familiar with the inside of your mouth. Go and stand in front of a mirror, make sure it's brightly lit, have a really good look, but don't panic if you see something that looks strange or weird, because it's probably completely normal. So get familiar with what's normal for you. Get to know the inside of your mouth, and then you will hopefully notice when something does change and something is unusual. So as Matt said, looking for white patches, red patches, ulcers that don't heal. Have a good feel as well, see if the texture feels thicker or different, or it feels bumpy. Just look for things that are strange for you, and I think you would know. Matt was saying about feeling down the neck and under the jaw. What you're feeling for there is an enlarged lymph node. So the glands that defend the body, they can become enlarged if there's a problem. It doesn't necessarily mean cancer. It could be an infection. It might be that you're fighting a virus. But they would feel a bit like a baked bean, that sort of size and shape if they're enlarged. And again, just wait and see. And if it doesn't disappear after a couple of weeks, that's when then you might be going to get it checked out. So you can do a self-check in about 45 seconds to a minute, and maybe do that once a month. Have a little look round and have a look and a feel. And yeah, by all means, you can self-check.
Brilliant. Especially how...
Sorry to interrupt. If you do find something that you're not sure of, don't feel like you have to wait till your 6-month checkup. It's all, you're more than welcome to come in sooner if you need to be.
Sage words, absolutely. But what if I can't get to see a dentist, and the only thing I've got to rely on is my own checks at home? Is that a problem, Catherine?
I think if you can't get to see a dentist, and let's say now, I know some people having problems getting to see a dentist, you can ask your GP. You could go to a pharmacy as well. Pharmacists are used to looking at things, particularly ulcers. They'd be able to give you advice. Quite often they might then say, go and see a dentist, potentially. Have a look at portmandentalcare.com and we can point you towards a practice that is taking patients on. So I think do look yourself, do monitor, and if things aren't changing, then do get attention. Don't hang on and wait. It doesn't have to be a dentist. Just make sure you get it looked at, because the earlier it's diagnosed, the easier it is to deal with.
Yeah, thanks, Catherine. Sage words indeed, because that cancer is such a scary word for people, isn't it? What causes mouth cancer? Is it lifestyle choices? What actually causes these lesions in our mouths? Matt, let me come to you for that one.
Yeah, a lot of it is lifestyle choices. So the two massive factors are smoking and alcohol. Like with so many diseases and so many cancers all over your body, mouth cancer is no different, really. And the effect is it's not kind of on or off. It's not like if you smoke, you'll get it, and if you don't, you won't. It's kind of smokers, so a kind of a moderate smoker, for want of a better term, their chance of developing it is roughly doubled, thereabouts. A moderate drinker, similar. So if you're a moderate drinker, then your chances of getting oral cancer are roughly doubled. If you smoke and drink, this is where it starts getting quite interesting. Your different studies come up with different numbers, but you're potentially around about 10 times more likely to develop it. So it's not, the two seem to have an effect when combined beyond each of their own parts as well. And then also, kind of beyond that, if you're a heavy smoker and a heavy drinker, then you can be, some studies have found, around 35 times more likely to develop oral cancer. So it is very lifestyle dependent, and diet comes into it as well. There's generally eating a good diet, fruits, vegetables, antioxidants, all these good things that we know are good for us. They play a part as well. It's not quite as black and white as smoking and alcohol, but living a generally healthy lifestyle seems to reduce the chances of you having any issues as well.
So if I go to the dentist and have my oral checkup, but I like drinking and smoking, am I going to feel judged by you as a dentist?
Depends on the dentist. No, I'm joking. No, do you know what? Most of us, a lot of us will have a drink. A lot of dentists will might smoke. We're humans as well, and we've got family and friends who drink and smoke and everything else. So not judged at all. I would say maybe the opposite's true. Maybe we feel more caring towards people who have these things going on, because actually they're more likely to develop these things. So we're probably going to keep a slightly closer eye on them. So I'd maybe say the other way around.
That's reassuring. Thanks, Matt. Catherine, anything to build on what Matt's just been talking about?
Well, the one thing that's becoming more prevalent is, as a risk factor, is also the human papillomavirus, HPV. That is a virus that a lot of people are aware of because, of course, teenagers have the HPV vaccine at school now, and it's been around for a long time as a vaccine for girls to prevent against cervical cancer, and only more recently for boys as well. Human papillomavirus contributes to about 5% of all cancers, so it is implicated in quite a lot of cancers. And increasingly, we're seeing that the HPV positive mouth cancers are increasing. So in the population as a whole, mouth cancer is increasing, unfortunately. And we think that this is a contributing factor alongside those lifestyle choices. So HPV is passed by skin-to-skin contact. So it can be sexually transmitted, and even a condom won't prevent it because it is skin-to-skin contact. So it is quite important. It's not necessarily mean that you're promiscuous if you catch it. It could be one partner. I think it's important to say that. So that's where the HPV vaccine is quite critical at preventing the numbers that we're seeing of mouth cancer.
Great. And how old do I need to be? What age can I get that vaccine, Catherine?
I'm afraid we're all a bit past it, Andy.
Speak for yourself.
So 12 to 15-year-olds generally, it's a school program, but you can get it up to 25. Maybe we could pass under the radar, couldn't we, Andy?
20.
Yeah.
Maybe 26. I'm not sure about 25.
25 under the NHS. Whether you can pay for it privately, you'd have to speak to your GP. It's most effective if you get it before you're first sexually active, which is why we like to capture that teenage age group. Unfortunately, we did see a bit of a dip in people having the HPV vaccine in COVID. Obviously, schools weren't open in the way that they were normally. So some children were missing out on the vaccine, unfortunately. There's been a lot of work to catch up with the vaccine program, and I think that's happened really well. And, the vaccine we know is very, very effective, 97% effective. So I definitely encourage anyone listening, any parents listening, ensure that your children are getting that vaccine when it's offered to them.
So it sounds to me all the way through our chat today that mouth cancer, prevention is better than cure. Absolutely, I'm sure. So how can I prevent it? Are there any any steps that I can take to prevent it? Matt, let me come to you for that one.
Well, yeah, I suppose the opposite of what we spoke about before. So, if you don't smoke, don't start, and if you don't drink, don't start. But also, it's important to realise that it's not, like I said before, it's not kind of an on or off thing. So, smoking less will help, drinking less will help, cutting out one of the two will massively help. I think I read that if you're a smoker and then you give up, after between 3 and 5 years after you've given up, your risk of developing mouth cancer has actually dropped by 50%. So, it's worth doing. It's not like the damage is done, never mind, I might as well crack on. You can make changes, and they do have a very real kind of tangible effect on that risk.
And of course, the HPV vaccine that you mentioned, Catherine, could be a preventative step to take for younger patients.
Yeah, absolutely, 100%. Definitely recommend where that's available to make use of that, for sure.
So if I am over the age of 25, is there no way that I can get the vaccine at all, Catherine?
I think you would have to speak to your GP. I'm wondering if Karen can maybe help us with that question when she joins us shortly,
Yes.
because I'm pretty sure it must be available privately somewhere. Yeah.
Yes, great. Let's bring Karen in just a little bit later. I've just got a couple more questions for you both, if that's okay with you. So I've done everything that you suggested. I'm even checking my mouth at home, and I might have spotted something in my mouth. What if I do spot something that's worrying me? Who do you think I should see first of all? Is it the GP or a dentist? Catherine?
I'd go to your dentist if you can, for sure. We're very familiar with the inside of the mouth. We know what looks normal and when something doesn't look quite right. We can't diagnose there and then. We would need to refer you. So we would send you to a specialist. So we'd send you to an oral maxillofacial department at the local hospital, and they would see you quite quickly for something like that. What we're seeing, unfortunately, at the moment is that because people can't get to a dentist, we're seeing a lot of late diagnosis of mouth cancer. And when mouth cancer is diagnosed quite late, it has quite a poor prognosis. So we'd really like to see people as early as possible. Then they can be referred appropriately to the right people, and they can have the treatment that they need as quickly as possible, because it really is very treatable if caught early. So I think that's the key message. The sooner a dentist has a look, the better, really.
So what advice would you give to somebody if they do put off seeing a dentist because they're worried that you will find mouth cancer, or that they do have it?
I think, it might sound quite scary, and maybe they're nervous about coming to the dentist like you were when you were younger, Andy. We are just looking. It's quite a simple screening, so please come and see us, because we'll hopefully be able to reassure you quite quickly that perhaps it's nothing. And I wouldn't want to think that anyone was sitting at home watching this or listening to this and worrying about something that was actually very innocent at the same time. So yeah, please come and see us.
Thanks, Catherine. Thank you. And Matt, last one for you. What happens if my dentist does spot signs of mouth cancer? How are you going to tell that to me? I'm nervous about that conversation.
Yeah, well, exactly, as you can imagine, it's not an easy conversation to have. Partly also because without as Catherine said, would refer you to the local maxillofacial department of the hospital, and without the tests and the biopsies that those guys would do for you, we can't really say for sure anyway. The vast majority of ulcers are harmless. The vast majority of coloured patches or lumps and bumps are harmless. So I think, speaking personally now, if I were referring someone with, it would be more of a, there's something not quite right here. There's a very, very high chance that it's fine and not going to be anything significant, but I'm just going to get them to have a look and exclude anything nasty. So it's more, I would say that we're kind of, even though what we spoke about quite a lot is, don't be sitting at home worrying about these things. Come and let us check and let us make sure that, it's nothing, just harmless. Even then, what we do refer, the majority will also be harmless. We still err on the side of caution. So if your dentist is referring you in for a lump or a bump, just bear in mind that, it's very, very important to go to that appointment and get it checked, but don't think that, there's a definite diagnosis there. It is verified, and we are probably erring on the side of caution by sending you in.
Great. Thanks very much indeed, Matt. And Catherine, some brilliant clinical insights there, some brilliant little gems that we can all take and check ourselves at home, think about our vaccines if we're not vaccinated against HPV, as you were talking about, Catherine, and some great top tips from a clinical perspective. Thank you so much. Stick around, because I'm going to introduce Karen Coates now from the Oral Health Foundation, and you might be able to chip into that conversation as well, team. So Karen, really warm welcome to you from the Oral Health Foundation. What exactly does the Oral Health Foundation do, Karen?
Well, we're a self-funding charitable organisation that we've been around for almost 50 years now. Not me, obviously, but yeah, we've been around for quite a long time, and our aim is to advise patients and the profession, anybody who wants the advice really, about oral health matters, how to have good oral hygiene, how to prevent oral disease, obviously including mouth cancer, but we look at dental decay, gum disease, etc. And we run campaigns such as Mouth Cancer Action Month and National Smile Month, along the lines of just raising awareness of everything dental, really. So we have a great website, we do podcasts, we do videos, we do interviews, we come on things like this, and thank you very much for inviting me, so that we can just get the message across. So we are very, very public facing, so all of our information is, we try and take the jargon out of it, because as dental professionals we do find it very easy to talk in dental terms, but obviously we don't want to use the big horrible words that people don't quite understand, and without being patronizing, we want to make people understand the importance of having a healthy mouth, healthy body, etc.
Yes, great. And whilst we're talking about the focus of today is on mouth cancer awareness, that you educate people in all things to do with oral health and oral hygiene, then Karen, that's what an oral health educator does. Is that all-round holistic view of the mouth? Is that right?
Yes, it is really. I mean, it's sort of changed to suit the person, because not everybody is the same. As Catherine said earlier, people's mouths are just not the same. We're all slightly different. So what's right for one person may not be right for another. So that's sort of looking at dental resources as well, using the right tool for the right person for the right job. So to get the best and most effective oral hygiene routine. But looking at their diet, and just even looking at safe swaps. So looking at your lunchbox, looking at, we all pop into a supermarket, get a meal deal, but we can always make swaps to make it more tooth friendly. So all of those kind of things. So it is quite wide ranging. Obviously, Mouth Cancer Action Month is a really important one, because as Matt and Catherine have said, there are a lot of people. Year on year, the cases rise and the mortality rate rises as well. So it's really important to get on top of the signs and symptoms and get there quickly. If you go on our website, there is a great video of somebody actually doing an oral cancer check on themselves. There is also a dentist doing one as well, so there is a bit for the profession as well. So they're great to have a look at. So we do a lot of that. So it's very visual, because you can show somebody on a piece of paper and it really doesn't, it doesn't look like a real person, does it? So it's quite nice to see it in video form.
Yeah, fantastic. Thanks, Karen. I saw the website flashing up there where people at home can go to. Sticking with the website, Karen, are there any other downloadable information, leaflets or anything like that I can have a look at and print off?
Absolutely. Yes. I mean, we've got obviously things during this month, Mouth Cancer Action Month downloads, but for the whole of the year, we've got downloads on, I think there's probably 50 odd leaflet titles, ranging from treatments to oral conditions. And, not everybody will need every leaflet. I mean, if nobody would need a leaflet on geographic tongue unless they had geographic tongue, and it's great way for a dentist to point somebody, if they do get somebody with a condition that you don't really want them to Google it, because it will send out all the wrong messages. Point them in the direction, and I'm sure they will find something. We've got mother and babies, we've then got the child's teeth, we've then got my teeth, we've then got teens' teeth. So it kind of covers the whole range. So, we've got things on smoking and stopping smoking and vaping and, everything that you could possibly think of, I think. I don't think we miss much out.
Great. Karen and Matt, let me draw you back in. Karen's spoke a lot about education, and of course a number of our dental nurses in Portman Dentex, they're also trained as oral health educators, and we specifically put people through that learning program that the Oral Health Foundation recommends and delivers as well. Those colleagues that we've got in practice that do that they must be quite reassuring to you, to have dental nurses that are trained in oral health education. To what extent do they support you in your role with checking for oral hygiene?
I think there's we get a lot of support from the rest of the dental team altogether, Andy. So the hygienists and therapists are absolutely brilliant in checking for mouth cancer, so they'll play their part in the screening aspects, and the whole team, so whether it's an oral health educator, a hygienist, a therapist, or a dentist, we're all knowledgeable about kind of signs and symptoms, and most importantly about prevention, really. So we're all qualified to be able to give advice. So it is a whole team effort, and quite often, even the receptionists are aware if somebody mentions certain things where you're thinking, that does need looking at. They are aware to get that patient in, to get them seen, and equally looking after patients who've had mouth cancer in the past as well, and treating them like VIPs, making sure that we're really looking after them, and checking them thoroughly on a regular basis, and getting them in quickly if we've got any concerns or they've got any concerns.
Great. It's reassuring from a patient's perspective to know that so many people in the practice can help with oral hygiene, and of course that being aware of mouth cancer. Karen, another one for you. Can children get mouth cancer? What does the research tell us there, Karen?
I mean, they're less likely to, because obviously they don't tend to have the risk factors that older people do. I mean, certainly when I was training, it was seen as a male over 40 condition. We're finding now the ages are dropping much lower, and they tend to be, as Catherine was talking about, the HPV caused cancers. So we, on our website as well, you can have a listen to some of our mouth cancer ambassadors. Now, these are people who have actually been through diagnosis, treatment and recovery from mouth cancer, and they talk you through their stories, which are absolutely amazing, and they talk much better than any of us could about mouth cancer, because they've been there and done it. So they're very, very good. But, some of them are 25, 26. So it is getting much, much younger. So we can't immediately say, oh, you're only young, you can't possibly have it, because that's not the case these days. The ages are dropping. I mean, still it is predominantly older men, but we can't discount anybody from it.
Thanks, Karen, and thank goodness for the Oral Health Foundation. What can people do if they really want to support the Oral Health Foundation? Karen, how do we get involved with that?
Well, certainly for Mouth Cancer Action Month, there are lots of ideas on there for sponsorships, and people have jumped out of planes, and in fact, some of our staff have jumped out of planes. Not me, but anyway, maybe bake something sugar-free, of course. Have all sorts of things. We've had people walking across the country, and even it doesn't have to be anything big. It can be something little, and obviously all the money then goes into the campaign and supporting. And obviously, Portman Dentex have been great in supporting this year's campaign and getting the message out. And I think we've kind of used all your experts quite a lot with a lot of interviews and TV appearances, etc. this year, which has been phenomenal in getting the message out, and we hope to see some great results from the uptake of this, because we're predicting, obviously we've got to wait till the end of the month, but we will predict how many people have actually seen this message, and if it helps just one person to say, hold on a minute, I've noticed something a bit strange, then we've done our job, haven't we?
I think that's it, Karen. 100%. It's just getting people talking about it. So, like you say, if it's just one person who starts to talk about it some more, because people just aren't aware that mouth cancer exists as a thing. So that's a good start. Just having those conversations. Your mouth is so important for everything that we do day to day, whether it's speaking, eating, kissing. It's vitally important, and you need to take great care of it.
That's why when you listen to the ambassadors' stories, it's things that you don't even think about that have changed for them. And when mouth cancer is caught in stage 3, stage 4, the treatment is so much more complex, and the operations are so much more invasive that things that they've had to relearn to do, and they've done amazingly. So it's really, really important to just get the message home about early diagnosis. And just going back to your point about your question about HPV vaccine, you can have HPV vaccine whenever you want to have HPV vaccine. However, the older you get, the more doses you'll need. So now, since September this year, it's gone down to 1 dose, which is great, because we were finding a lot of school children were having the 1 dose but not the second. But research has shown that the 1 dose does pretty much as much as the 2. I think there was only 1% difference. So it's only 1 dose now. However, the older you get, it could be 3 doses you need. So your GP will be able to tell you anyway.
Thanks, Karen.
Thanks, Karen. Would they charge for that, do you know?
They will, yeah. Per dose, and I would probably say I think it's about a couple of £100 of a vaccine.
Right.
So it may not be that you need it. I mean, if you have been in the same relationship for many, many, many years, you probably don't. And I did read some research that a lot of new cases do tend to be people who are setting out on second relationships. So they might be married 20, 25 years and then are setting out on second relationships, and obviously not protected against HPV. So that's something to think about, maybe.
Yeah, absolutely. Thank you very much, Karen. All of you, thank you so much for joining us today, Catherine, Matt, and Karen. It's great to see Portman Dentex working so closely with the Oral Health Foundation. It looks as if there's some great collaboration going on, which is absolutely amazing. What should we tell people who's got a question after the session? Who should they contact and how? Karen, that's probably more one for you, for the Oral Health Foundation.
Yeah, I mean, certainly you can. Let me just think. Probably the best email address is probably our PR address, because it will come to all of us, and then they can pass it on to me. So that's PR@dentalhealth.org. That would be great. then I know it's gone into the right mailbox and I won't be searching.
Yeah.
But yes, that's fine.
Great stuff, Karen. Thank you so much. Very last question. After all we've said today, I'm still scared to go to the dentist. What's your top tip, Catherine?
Top tip, just do it. Take somebody nice with you though, Andy, to hold your hand.
Take somebody nice. Great. Any builds on that, Matt? What would your top tip be?
Yeah, just rip the plaster off. Just go. It won't be as bad as you think. It never is.
Yeah.
I'm going to be more gentle with you there. I would say break it down into small pieces, because if you look at the whole picture, it's a mountain to climb. So just start off by, going into the practice, having a look round, getting a practice leaflet, talking to the receptionist, walk back out again, and then build it up slowly. And at each point you can congratulate yourself and you can get yourself into the surgery. And once you're in there, there's lots of tips to do. You can kind of, I've done this, I'll just have to show you with my, so you touch each finger like this and just keep doing that and concentrating on like a force coming up your body from your feet upwards. Take something to listen to so you can't hear noises. There's lots of tips that we can give, but I would say just getting into the surgery is obviously the first point, but don't think that is the first thing you've got to do. Just plan it a little bit more, break it into smaller pieces.
Maybe peel the plaster off slowly then. That's fair enough.
That's much better.
And some practices, of course, will have people like yourself, Karen, who'll just sit and chat to you, so you don't even have to climb into the dental chair first. They might have a treatment coordinator.
On our helpline, when our helpline was open, I would say we probably got 4 or 5 phobics every day calling. And we've had great success, calling us back saying that they've got in and they've had treatment done. So hopefully those little tips will just help. And they're not alone. And most people think they're alone in it. They think they're the only person in the world that's scared of going, and it's far from that.
That's definitely true. I think that's really important to remember. Matt and I are seeing people like this every day. So, we're perfectly used to helping people feel relaxed and comfortable.
Yeah, and please never feel like we're judging you because you haven't been for 5 years or 10 years or whatever it might be. It's never, however long it's been, we've seen longer. I had a guy when I worked ages ago, he'd not been to the dentist for like 57 years or something like that. So we've seen it all before. So please don't feel like, you're being judged or thought less of in any way when you do this finally manage to get it.
I'm going to write a book of helpline stories, because those are absolutely fascinating, about people who haven't been to the dentist or brushed their teeth or whatever. But that's what I always say. Whatever you're going to show the dentist, they've seen worse.
Yeah.
Or smelt worse.
That's not enough dentist.
That's a pleasant note to end the session with. It's smelt worse. I bet you've had some people that have done DIY dentistry as well. I'm sure you must have done. Great. Well, team, thank you so much for giving up your time to chat to us this lunchtime. Much appreciated. Really hope, and I'm really sure you've helped raise that awareness of oral cancer in people's mouths, of course. Join us again on Wednesday. We've got another session on whitening. We'll be going live at 12 o'clock. So if you want your pearly whites, just like everybody on this call, then join us again on Wednesday at 12 o'clock. Thanks very much for joining today and for watching and listening. And thanks very much to you, team, once again. Thank you.
Thanks.